on the outside of the device. The other device here is a Dacron fabric that has hooks at the top of the device and at the bottom of the device. The hooks actually grab or secure the device into the wall of the blood vessel. So in this particular case, the hooks here and down at the bottom are actually balloon fixated into the wall of the vessel, and it very much so mimics what we do when we operate on people by opening the belly. Instead of using a monofilament suture to sew the vessel in, we actually use a balloon passed from the groin approach to secure hooks into the wall of the vessel. And if anyone's interested, I did bring one of the devices here. It's encapsulated in a piece of plastic, but if they would like to take a look, and maybe David pass that around if anyone wants to take a look. These two devices that we're showing here are the two most frequently deployed devices in this country, and both devices are effective at treating this problem. The specifics of which device is better for which patient is sort of a complicated issue, but one that really falls into decision making that a vascular surgeon would make with you. One of the things about decision making, you say, well, if we can place this device or one of these devices through an approach in the groin and avoid opening the belly, why wouldn't we do that every time? The answer is there's some anatomical constraints, number one, and what that means is from an anatomy issue, not everyone's a candidate for it, and in fact I would tell you that from personal experience about 50% of people are candidates for this newer technology, if you will. Now this technology is evolving, so those numbers will probably change over time. The two main devices that we deploy were the first two FDA approved devices for this, and these two devices received FDA approval just a couple of years ago in 1999. And as it turns out, another device earlier this year has received approval, and another device just received FDA approval within the last week. And I think this indicates motivation by the FDA that these devices are here to stay and are helpful. In terms of the next thing that it says up here is precise measurements. This is a very important part of this, and that is identifying the specific anatomical issues that would help us determine whether someone can have a stent graft or not. This is a picture of Dr. Wolkin and I looking over some x-rays, and this right here is an aortogram, which is basically a catheter-based x-ray